You ready, Tony?
Go ahead.
Okay, so patient presents to clinic with limited active range of motion and passive range of motion due to complaints of severe pain. No hypomobility was of note with posterior and inferior joint glides, grades 1 and 2 of the right shoulder. Okay, what do you think I would follow with next? Because I go kind of in order of my treatment when I talk to them.
Well, what you if we could, what you just said right there, basically was that when you did the joint modes, what would you have felt if that wasn't the case, if you didn't?
So noted stiffness was note, boggy infield was of note, hard infield was of note, things like that.
Okay.
Would you then move on to, because if I remember correctly, you had her here, and then you then went on to
Soft tissue.
yeah.
So
Could you describe like what you felt if she was guarded during it?
Yes, I absolutely would. So no notice of pain noted along the delts, anterior, lateral, posterior. However, in the external rotator muscle bellies, patient was notably tender to palpation. However, no visible expression was of note. In mid-scapular region, there was noted increase of tone. However, she had no complaints of pain there. Significant guarding and trigger points were of note in the right upper trap versus the left upper trap. That paints a really good picture. Minimal passive range of motion of cervical rotation to the right and forward bending elicited severe pain. No headache was reported later. That's important because you're looking for blood flow. So, okay, if a headache was reported, we might have an issue with some kind of vertebral thing going on. No dizziness was of note. No vertigo present. Okay? So, that's that soft tissue part. That's your modality, so shows skill to write all of that. Then what did we do? We got up. All right, so in order to improve flexion range of motion, external rotation range of motion, and abduction range of motion, different versions of table slides were performed within pain-free ranges. After completion of table slides, noted increase of range of motion to 90 degrees active range of motion compared to initial eval was obtained. This intervention created improved range of motion. The exercise I chose elicited this response. Insurance companies like that. If they have a regression, you write why did that regression happen. Noted decrease in range of motion was noted with significant pain. I should have educated on total shoulder stuff. I wouldn't ding you on that, but I should have done that. Okay, so let's see, what else did we do?
What education would you give for total shoulder?
What questions do you have for me in regards to total shoulder, Sabrina?
What is it?
Mm-hmm.
Well, she's already had her appointment with the doctor, and that's in your note, so you don't want to assume that they're ignorant. But hey, what do you want to know about a total shoulder?
What can I not do afterwards?
Okay, do you remember if they talked about reverse or just a regular total, because I didn't see it specified here.
In my scenario, I didn't say anything. I'm just gonna say
It
just
didn't
regular
say,
total.
okay, it just says total shoulder. So with total shoulders, more often than not, the rotator cuff is kind of blown. And that's why your manual muscle tests are so weak. You're relying on your delt to help raise your arm and do the things. That's why it hurts so bad, and that's why your neck hurts so bad. That upper trap is trying to take over and help you live your life. So one thing with the total shoulder, people don't tend to get to 180. I have seen some that can, but you may not get, you will get in very functional limits. Like I've seen people easily get to 140, 150. External rotation, there's a little bit of limitation just because of the hardware in there. And you're also only relying on one part of your delt to be able to do it. Okay, does that make sense so far?
Yes.
Okay, what do you want to know about recovery?
How long is that?
So it's anywhere between 12 weeks and 6 months. It all depends on you. How long has your shoulder been blown? It's been chronic and distant of several years. Okay, so it's been several years since your shoulder's probably been destroyed, right? Okay, so it's probably gonna take you a little bit longer than you want, and that's okay. So you're probably looking more at that 15 to 20 week recovery.
Okay.
So give yourself a little bit of grace. when it comes to the strengthening part, okay?
Okay.
So, because you've been relying on your delt for so long, now we're all of a sudden chopping things off and putting things in,
Okay.
okay?
Can I still sleep on my right side?
It's gonna be a while, but it's possible.
Okay.
You're probably looking at about 1.5 years for that,
Okay.
okay? Just because it hurts, not because you can't, but you're gonna wake up feeling like you've been stabbed.
Okay.
Okay?
I already wake up like I feel like the stab, so that's not gonna be a change.
And, yeah, well, it'll be a little better, a little worse maybe, but hey, at least the arm's gonna move better.
Okay.
You are looking at being in a sling anywhere between 6 to 8 weeks.
Okay. Can I take it out of the sling?
If you're sitting still, like if you're just watching TV and you have a pillow underneath it, that's totally fine. Okay, so let's